The former health secretary claims the proposals were still being considered before the COVID pandemic, which then distracted attention. Matt Hancock has said COVID caused him to drop plans that would have allowed NHS managers found guilty of serious misconduct to be barred from working in the health service. The government commissioned leading barrister Tom Kark KC to design an improved system of accountability for senior executives amid concerns those guilty of misconduct are able to find jobs elsewhere in the health system. According to The Telegraph, Mr. Kark called for a new Health Directors Standards Council with the power to disbar managers for serious misconduct, while NHS doctors are controlled by licenses awarded by the General Medical Council. No such body exists for NHS managers. At the time, the then Health Secretary Matt Hancock said he could see the attraction of such a system. However, plans to implement the recommendations were ditched after the COVID pandemic hit, citing the scheme's complexity. Following the sentencing of baby killer Lucy Letby on Monday, attention has moved on to the failings of the NHS managers. With hospital chiefs accused of walking away from life-destroying mistakes, doctors raised concerns with executives when they noticed the unexpected number of baby deaths at the Countess of Chester Hospital. This afternoon, a senior manager accused of ignoring concerns about Lucy Letby and protecting her was suspended from the NHS hospital she now works in. Alison Kelly was the chief nurse when Ms. Letby killed and hurt babies under her care at her Chester hospital, though had since moved to the Northern Care Alliance NHS Foundation Trust in Salford. Despite the failure to introduce a new system to bar managers from working in the NHS, Mr. Hancock's spokesperson argued it would not have prevented the Lucy Letby scandal even if implemented in 2019. They said, this recommendation was still being considered when the pandemic. The recommendation would be very complex to implement, and sadly would not have stopped these murders, even if it had been in place at the time. Ms. Kelly is among 3 directors from Chester who have been publicly criticized over the scandal, alongside former medical director Ian Harvey, who is retired and living in France, and former chief executive Tony Chamber, who until this summer worked at a hospital in West Sussex. On Friday, Ms. Kelly said, "These are truly terrible crimes and I am deeply sorry that this happened to them. We owe it to the babies and their families to learn lessons, and I will fully cooperate with the independent inquiry," announced. There were additional concerns that the proposed debarring scheme would make the hiring of NHS managers much harder, as they would need to all be approved by a centralized register. Mr. Hancock has this evening joined those calling for a full statutory inquiry into the affair, saying, "This is without question one of the most monstrous crimes in modern British history. What makes it worse is the evidence that some of these evil murders could have been prevented. We need an urgent, full statutory inquiry with powers to compel witnesses to attend. It's so important to fully understand what happened, learn lessons for the NHS, and prevent a tragedy like this from ever happening again."